Good morning, scholars. First, I want to thank Ms. Fields for the opportunity to speak to you today about my career as a paramedic. So I am Mr. Gupton, or simply Stephen Gupton. Outside of being an educator, I am also a paramedic. I served as a paramedic for several years before I decided to go into the classroom and teach little boys and little girls like you. I absolutely enjoy being in the classroom, but today we're going to talk about what I do in the field and how I actually take care of sick people and critically injured people when the time and the opportunity presents itself. So as the video begins, you'll see some pictures of the ambulance. The ambulance is the vehicle that we use and the vehicle that we transport patients to the hospital on when they become sick or critically injured. And then you'll see some pictures of a quick response vehicle, which is like a normal vehicle, except we don't transport patients in that one, but we have equipment in there to treat patients at special events, or if we need to respond to a house a little bit quicker than we can on the ambulance, and so forth. So you'll hear my voice as you see the pictures, and I'm going to explain a little bit about schooling, education, what it takes to become a paramedic, what you need to do after you become a paramedic in order to function in the field. And then I will tell you my favorite part, and I'm almost sure you can already guess that, but stay tuned. So in order to become a paramedic, you'll need a high school diploma. After graduating from high school, you have three different options. You can go to community college and get a diploma to function as a paramedic. You can go to community college and get a 2-year associate's degree, or you can go to a university like Western Carolina in the mountains of North Carolina and get a bachelor's in emergency medical science with two options. One option being pre-med for those of us who may be interested in going back to school to become physician's assistants or doctors later, and healthcare management, those of us who want to lead an actual EMS system. After you graduate from any program, you have to do 1,000 hours of clinical field experience. So we have to take care of patients for 1,000 hours before we are allowed to function on our own. Favorite part of my career? Helping sick folk.